This is Radio Health Journal. I'm Nancy Benson. This week, near drowning and small children, how a safe rescue may turn deadly hours or even days later.
Boom, right before my eyes, he jumped in, and I jumped in to grab him as he literally sank down to the bottom.
Secondary drowning, when Radio Health Journal continues.
Medicare and their list of suppliers continue to change. So if you have diabetes, it may affect where you get your testing supplies. But rest assured that your number one doctor-recommended one-touch testing supplies are always covered by Medicare Part B at your local pharmacy and select mail-order suppliers. Dr. Brian Levy, Chief Medical Officer at LifeScan, maker of one-touch products.
Some mail-order suppliers may offer a limited selection of diabetes testing supplies. They may try to switch you to a different brand, saying your current products are no longer covered. That's just not true. You are entitled to continue using the products you know and trust and that have been recommended by your healthcare professional at no additional cost.
Remember, you have a choice. Stay with the number one brand used by Medicare patients. For questions about coverage or where to get your one-touch testing supplies, call 1-844-942-2654 or visit www.onetouch.com/Medicare. Medicare Part B is not a guarantee of coverage and payment, which may be subject to coinsurance, deductible, and patient eligibility requirements.
Every year, about 700 children under age 14 die from drowning in the United States. And for every child who dies, another 5 suffer a near drowning serious enough to require hospitalization. Even if a child is revived, to see a tiny, lifeless body pulled out of the pool is one of the scariest things a parent can go through, and it can happen in a flash.
He was 3 years old. I'll never forget it. Every year we visit Cape Cod. We go to the same place. I'm literally sitting at the edge of the pool, never thinking that my young son would just spontaneously jump in the water, and boom, right before my eyes, he jumped in, and I jumped in to grab him as he literally sank down to the bottom of the 8-foot pool.
That's Dr. Christopher Mikos, an emergency physician at St. Vincent's Medical Center in Bridgeport, Connecticut. He knows his son was lucky. Just having one's back turned for a second can mean a child enters the water unnoticed. And over the summer, it happens a lot. For kids age 1 to 4, drowning is responsible for more deaths than any cause except birth defects. In most cases, infants and toddlers are drowned in home swimming pools, but it can happen almost anywhere there's water.
It'll affect children, particularly very young children under the age of 5, from pool accidents, or just unfortunate accidents involving toilets or even buckets of water that unfortunately children can fall in. Can you imagine the tremendous guilt that a parent would feel leaving their child briefly in a bathtub to turn and reach for a towel, or maybe answer a phone, or maybe go downstairs to answer the door? It can be just taking your eyes off for that brief second that can lead to a horrific catastrophe. But also pools, suddenly just turning your back. Parents have to be tremendously vigilant in keeping an eye on the children.
Usually at this time of the year, there's so many people in a swimming pool just relaxing and having a good time, and it's hard to look at every single child. So if that happens, then a very short time is all that is necessary, and then the child could near drown or drown. It could be very fast. It could be within a minute.
That's Dr. Luis Terrero, Division Chief of Pediatric Critical Care at Advocate Children's Hospital in Oak Lawn, Illinois. He says particularly when a child aspirates water, critical injury to the lungs can be rapid. According to the National Safe Kids campaign, 92% of children who survive are discovered within 2 minutes of submersion. Mikos agrees time is critical.
Outcomes can be very serious if the duration of submersion in the water is greater than 5 minutes. That seems to be the most critical factor that they've proven over studies. It'll also depend upon the time to basic life support. The longer basic life support is not carried out, the worse outcome you have. If a prolonged CPR is being carried out in the field, that is also a bad predictor. So it's hard to say one specific thing that you can say why some survive and why some don't.
However, even when a child is safely revived after being submerged for a minute or two, they're not out of the woods just yet. The child may be talking and seem perfectly okay, but the situation could turn deadly hours or even days later.
If you have lack of oxygen for a short period of time, like for a minute or so, that can be enough of an injury to affect different organs, especially the lungs. In this case, could initially respond well to what the people at the site do and then at the hospital, but then can show signs later on of injury from the brief time that there was lack of oxygen. And even though it might not show early on, it can cause inflammation and then what we call pulmonary edema, which is basically that the lungs get full of water from the body.
That's why doctors often insist on hospitalizing children after a near-drowning incident, even when the child looks perfectly all right. Doctors want to keep an eye on the child for so-called secondary drowning, when the lungs fill up with water from the body prompted by injury to the lungs.
It's only a small amount of water ingested that can cause issues down the road, and that's certainly something that why you're referring to this particular case. And certainly, if there's any concern, the best place for any child or any patient that may have a possibility of deteriorating down the road is to observe. And in terms of hospitalization, most non-fatal drowning victims are admitted. There was a study once conducted regarding the pediatric patients that those that developed symptoms following a non-fatal drowning developed serious sequelae about 7 hours after the immersion. So that's why there is the concern to then monitor those patients for an extended period of time.
We keep watching the child. We could start noticing the saturations, the oxygen in the blood is coming down. The work of breathing is starting to look a little more pronounced, and the baby is a little more upset and maybe sleepy. We decide to look a little more into it, and we do an X-ray, and on the X-ray we see that there is something going on. The lungs are not looking as good as they did at the beginning. If they had an X-ray done early on, then it could progress into a severe state. There could be a respiratory failure. That is what we can call a secondary drowning.
When breathing becomes an issue, particularly with children, because they rely so much on lung capacity for life, particularly younger children, if there's any compromise to the breathing of a child, that can lead to a very serious deterioration very quickly.
That can happen whether a child is in the hospital or not. And sometimes kids are pulled out of the water without paramedics or doctors ever hearing about it. So Torero says the first couple of days after a near drowning, parents should look at their child the same way doctors do.
Basically, your baby starts to work hard to breathe. The baby's a little more sleepy, irritable, maybe some change in the color of the lips or the nail bed, some blue tinge in those areas. But more than anything, it's just you see it is that the respiratory rate or the breathing rate increases. You see that some muscles that we normally don't use to breathe start being very obvious, like the neck muscles or the muscles between the ribs pulling in, or the abdominal muscles. The babies are using them more because they're having a hard time breathing.
But while doctors keep their eyes on the child who's been nearly drowned, they can't ignore the rest of the family, especially parents who've tried so hard to keep their kids safe.
What I do deal with is the tremendous guilt, the immediate guilt that the parent feels when they're bringing their child in from an accident like this. You know, I just took my eyes off of him for 1 second, or we never thought that this could happen, or he was in his room and all of a sudden we couldn't find him. And then the tragic event that they find the child in the pool. That's the horrible feeling that a parent has. And trying to witness that and to counsel that is very difficult, because it is a tremendous emotional feeling that your son or daughter is critically ill. And again, you could just turn your back for a brief second and tragedy happens.
And Maiko says it can happen so fast that parents need to be much more vigilant than they think.
How many parents we see nowadays with smartphones and checking emails and checking Facebook? When you're in the pool or at the beach, this is the time to make sure your eyes are trained on your children at all times. So that way you can protect them from any risks out there, and hopefully everyone has a safe and enjoyable summer, and I don't have to see a poor drowning victim in the emergency department.
You can find out about all of our guests on our website, radiohealthjournal.net. Our production director is Sean Waldron. I'm Nancy Benson.
Radio Health Journal returns with medical notes in just a moment.
The National Cancer Moonshot Initiative, announced in January, aims to put a cure to cancer on the fast track. But to do that, real-time cancer data sharing will be required. Right now, it can take up to 2 years for data to be fully reported to government cancer registries. Speeding and standardizing the process is the goal of an electronic cancer checklist developed by the College of American Pathologists, or CAP. Dr. Richard Friedberg is president of CAP.
Currently, clinicians, specialists, and hospitals can take months or years to send data to a registry. Some time ago, we at the CAP knew that since we as pathologists are the ones who create much of that data, we could play a far more central role in providing more accurate, structured, and real-time data to better battle cancer.
The CAP is helping hospitals in Ontario and California in providing real-time reporting to cancer registries, a model that could be expanded through the Cancer Moonshot Project. Find out more at cap.org/news.
Medical notes this week. Among foods that have a reputation for being bad for you, butter may lead the pack. But a new study in the journal PLOS1 finds that butter's not so bad after all and doesn't really affect heart health one way or the other. The study shows that each additional teaspoon of butter consumed per day adds 1% to a person's overall mortality risk, but cuts the risk of diabetes by 4%. Butter is one of many saturated fats whose poor reputations are apparently being redeemed. Antidepressant use in the United States has increased in the past 20 years, but a new study shows that nearly half of all antidepressants are prescribed for something else. The study in the Journal of the American Medical Association looked at more than 100,000 antidepressant prescriptions and discovered that only 55% of them were written for depression. Researchers say doctors are also prescribing them for conditions such as anxiety, pain, and insomnia. And finally, reading your smartphone at the wrong time might lead you to think you're going blind. A report in the New England Journal of Medicine explains that people who read their smartphones in the dark while lying on their side may lose sight in one eye for a few minutes when they're done. Some people fear they've had a mini stroke, but researchers say it's really just an effect of the dominant eye having to readapt to the darkness. And that's Medical Notes this week. More in a moment.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.